The situation in Palestine is a multifaceted problem, encompassing economics, healthcare, education, and politics, echoing the problems in other neighboring Arab countries. However, almost everybody focuses their full attention on mending the political situation, which overshadows other problems and neglects Palestine's most precious asset, its human capital. My approach, however, is to seek solutions for relatively less complex problems, such as brain function. One of the major challenges in healthcare in Palestine is the very high prevalence of clinical depression, affecting around 40% of the population in the West Bank in Palestine, which is estimated to be around 1,060,000 Palestinian depressed patients in a population 65% of which is under the age of 24. It becomes clear how prevalent depression is in Palestine when we compare it to other countries. Can you imagine what would life be like in the US if 40% of the population is affected by clinical depression? Aside from the public health epidemic of mental health disorders in Palestine, other problems stand in the way of a solution, including the very high degree of social stigma associated with treatable mental disorders, inhibiting people from seeking healthcare, and the insufficient number of mental health professionals available for the care of those affected by mental disorders. The problem does not stop here, though, but rather is compounded by other problems in brain power, with limited to non-existent capacity for biomedical research and a growing brain drain, where the best and brightest Palestinians are tempted to move abroad to pursue their careers. Such a complex problem. However, failure is not an option. Given the young, genetically uniform population, unlike the melting pot of the USA, and the very high number of unmedicated patients, can we turn all these problems into advantages for advancing brain health and brain power in Palestine? In 2009, my colleagues from Al-Quds University and Rutgers Newark and I started building the infrastructure and capacity for improving and promoting Palestinian brain health and brain power through the Palestinian Neuroscience Initiative, based at Al-Quds University in Abu Dis, a town in the West Bank just outside Jerusalem. With a group of very motivated medical students, doctors, and faculty at Al-Quds University, whose aim is to forward research and well-being in Palestine through an integrative approach of training, research, and healthcare. We are training the next generation of Palestinian biomedical professionals in cooperation with elite institutions worldwide. We have a fabulous team of 40 researchers, specialists, and therapists who are all forwarding brain health and brain power in Palestine. We're also conducting local but internationally recognized research in Palestine, focusing on mental disorders in order to better understand that. Recently, and for the first time ever, we managed to delineate the effects or the impact of antidepressants on cognitive function, which can revolutionize treatment and has worldwide applications. We're also educating patients and their families in order to better understand their illness. Over the past 4 years, we managed to help 400 patients and their families receive proper diagnosis and treatment and know more about their disorder. Our program makes and will continue to make formidable contributions to healthcare and education while creating a powerhouse for neuroscience research in Palestine in order to stop the brain drain. With few natural resources and very modest space, the future of Palestine cannot be based on politics, but rather on its most precious asset, the human capital, building brain power to improve brain health, which can turn a dusty, empty, dark room 4 years later into a room full of energy, motivation, and individuals who are willing to make a change and shape the future of Palestine. Thank you.